And welcome to the Dr. Bob Show. We'll be spending most of this show talking about why your medicines are not working for your allergies, for your nose problems. Is it because you're not using your medicines properly? Could it be you think you have allergies and you really don't have allergies? Could it be something is wrong with the anatomy in your nose and you just can't breathe through your nose? We'll be answering your questions. My guest is Dr. Erin Rohman. Dr. Rohman is a board-certified allergist, and she'll be answering our questions. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about a devastating rash called shingles. Can we prevent it? Can we treat it? And also the difference between irritable bowel and Crohn's disease. A lot of information for you. You'll want to stay tuned. We're talking with Dr. Erin Rohman, board-certified allergist, and we're going to be answering why your medicines are not working. Erin, welcome to the Dr. Bob Show.
Thank you.
It seems to me that more and more people are becoming allergic. Is that true?
It is true.
Why?
Well, there are a lot of theories on that. Some people say possibly pollution, that probably holds the most weight, maybe global warming, but also maybe we have better diagnostic tools.
So if there's global warming, it may make a longer season and the plant mess?
That's right.
Yeah, it gets bigger, and so there's more pollen per day. Wow, that's hard for patients. So what are the main symptoms of somebody that has nasal allergies?
Well, the most common symptoms people think of are sneezing, runny nose, drainage, postnasal drainage, but also congestion, stuffy, difficult to breathe.
So you can have itchy, sneezy, and you can have congestion both?
Yes.
Do they all start at the same time? When do they come on?
Well, the initial phase of the allergic reaction typically starts with the sneezing and the itchy nose.
What's causing that?
That's caused by your eosinophils in your nose reacting to these allergens.
And then the second phase is?
That's much later in the response, but that's when you start having this congestion and the stuffy nose, making it difficult to breathe.
So the itching and the sneezing, is that the main symptom, or is it congestion when we ask people about your allergies? What symptoms is worse?
Well, I think the most bothersome symptom is the congestion.
So people have congestion, they can't just breathe. Do the allergy pills that are over the counter, does the Allegra, does the Zyrtec, does the Claritin, do they help the congestion?
Unfortunately, no. Those are not going to help with the congestion.
What do they help?
Well, they help some with the sneezing and the runny nose and the itchy nose.
So they're good with that. So if we're going to work after the congestion and the big antihistamines don't work, what do we have to use?
I'm afraid we're going to have to move on to something more, maybe something like a nose spray.
And what kind of nose sprays will help congestion? Because I've heard nose sprays for congestion you get maybe hooked on. So
You can. You have to be very careful about what you purchase, especially if you're buying over the counter without the supervision of your doctor. The ones that are out over the counter now are Flonase and Nasacort. They have a steroid in them that helps most with that congestion and stuffy nose.
And do they work by getting the eosinophils that you mentioned, a cell in the nose, that they tell the eosinophils to get out of there?
Well, they work several ways actually, but ultimately they do reduce the inflammation in your nose and reduce your swelling.
And the typical antihistamines that we all see on television are not going to work.
No, those are not going to work as well.
So the stuffy nose, what are some of the other causes, other than allergy? What would be some of the other causes?
Trauma. You could have been hit in the nose as a child with a baseball or something.
And have a crooked nose?
That's right.
Or a football nose?
That's right. Most likely that would be septal deviation. You can also have...
Septal deviation, what does that mean?
That's
crooked nose?
Essentially, that's when the septum that runs down the middle of your nose pushes to one side or the other, making the nasal stuffiness more prominent.
So when you got a stuffy nose to a crooked nose, you either need to get it fixed or you have to learn to live with it, so you need to get it fixed. So crooked nose, that's the anatomy. What else?
Polyps.
What are polyps?
Polyps are growths of tissue that form inside the nose. They can be a result of uncontrolled allergies.
Now, polyps in the colon are precancerous. Are polyps in the nose precancerous?
No, they are not.
Do medicines work for those?
Unfortunately, medicines don't help very much with those. It typically takes surgery to improve those.
So we've got anatomy, we've got polyps, we've got trauma. What else can make the nose stuffy?
Well, you could be improperly using an over-the-counter nose spray. That's called rebound congestion. That can cause nasal stuffiness as well.
So that's the Afrins, the Sinexes, the 12-hour decongestants. What happens? Why do they make things worse?
Well, they help initially, so they have an instant gratification for the patient. But unfortunately, over time, you get what's called a rebound congestion, and that congestion and stuffiness comes back worse than what you started with.
So it really is a difficult problem from that. So let's go to, if you don't know if it's due to trauma or congestion or rebound, and you don't know if it's allergy or not, is there such a thing as a sensitive nose?
Absolutely, yes. Vasomotor rhinitis is very common, and it actually has nothing to do with allergies.
So do you see that commonly in your office?
I do see that very often, yes.
So you'll see an allergic nose, you'll see a vasomotor rhinitis, you'll see a crooked nose, you'll see a nose with, so how do you know if it's allergy?
Well, it's very difficult, and ultimately, you should see an allergist. A board-certified allergist can perform allergy skin testing and give you a diagnosis right there in the office in a matter of minutes.
So what's skin testing like?
Skin testing starts with some pricks, some little scratches on the back.
Did they hurt?
No.
So how does that tell you? If you pick the back, how does it tell you?
Well, we watch for a response on the skin to that prick. And we measure that, and we can tell you exactly what you're allergic to right in the office.
So you can tell the patient what would they likely be allergic to if you could find it, if it was allergy.
That's right. And if it's not allergies, you would have a negative test, and we can tell you that as well.
So you can say, gosh, we all thought it was allergy, and you thought it was allergy, but the skin testing's negative. So all these allergy medicines may not help you.
May not help you.
Do you know how to treat the vasomotor rhinitis, the sensitive nose?
Yes, there are some alternative nose sprays for that can be helpful. They are by prescription.
But the biggest thing is you can determine only by the skin testing if that blocked head, if that nasal stuffiness, and by the exam. Can you see a crooked nose?
Absolutely. In the office.
In the office. Mm-hmm. Can you see polyps?
Yes.
What do the polyps look like?
They look like peeled grapes, actually.
So you've got peeled grapes in there that are not, or sometimes are not due to allergy, sometimes can be aggravated by that. So the skin testing will determine whether you have allergies or not, and therefore saves the patient a lot of time, and they can begin to understand why their medicine is not working.
Right, and then tailor that management accordingly.
So when you tailor the management, what do you do?
Well, you can start with medicines. Some of those are available over the counter, some by prescription, and then you can go further. Look more for a cure with something like allergy shots or immunotherapy.
Are allergy shots and immunotherapy, is that effective?
Absolutely effective.
And that's what we're going to be talking about when we come back. Absolutely effective allergy shots? Yes, if you're allergic. And the only way you know is skin testing. Hello, I'm Dr. Bob Overholt, here to encourage you and your family to get out and play in our Knoxville area parks. Knoxville has dozens of parks and more than 85 miles of trails. There are picnic shelters, ball fields, tennis courts, and disc golf courses, dog parks, fishing ponds, and skateboard parks, trails for hiking and mountain biking, boat rentals, you name it, Knoxville has it. To find a park or greenway near you, visit OutdoorKnoxville.com. And get out and play, it's good for your health. We're talking with Dr. Erin Rohman, board-certified allergist, and we've talked about why people may not respond to their stuffy nose, sniffles, and drainage. It's because it might not be allergy. It may be something else, like a sensitive nose, like a crooked nose, like polyps in the nose, like infection. There's lots and lots of causes, and the only way that you can find is skin testing. So, Erin, it was a great summary. Let's go back to the allergies. Are there different patterns of allergies?
Yes, you can have seasonal allergies.
Now, what is seasonal?
Seasonal people typically refer to spring, summer, and fall. Spring and fall typically causing the most trouble for
What
patients.
causes problems in the spring?
Tree pollen typically, especially in the beautiful state of Tennessee.
Oh, I know it. So is there a lot of, does pollen come out of the pretty flowering trees, or it comes out of other trees?
You know, interestingly, pollen can come from lots of different types of trees.
What's the one that you think causes most problems in your area?
In my area, I see a lot of oak pollen, I see a lot of birch pollen, I see a lot of maple pollen.
So those are all three. How does the pollen cause the problem? We breathe it in and what happens?
That's right. The pollen is inhaled into your nose or mouth. It encounters those allergy immunoglobulins and cells that we talked about earlier in the nose, and then those cells are activated to release lots of different chemicals that cause that congestion, sneezing, itchy nose.
All right, that's the spring. We've got tree pollen. What months?
That's typically, it can start as early as February, late February, but March and April, we're in full bloom.
When does grass pollen come around?
Grass pollen can start as early as May and typically begins to fall off around August.
So you've got spring pollen in the fall. What's the classic fall allergy problem?
Everyone thinks of ragweed in the fall, but actually there are lots of different types of weeds that cause problems.
So you can only detect which weed it is by allergy testing?
Through your allergy skin testing, correct.
Which tree it is by?
Allergy skin testing.
Which grass it is?
You heard it, allergy skin testing.
So those are seasonal. What about, are there kinds of all year round? What do you call that?
The year-round we typically call perennial allergens, and those include your pets, your favorite cat, your favorite dog, as well as mold, which can be both indoor and outdoor, cockroaches and dust mites too.
So dust mites, what are those?
Dust mites actually live in our bedding, typically.
Pillows, mattresses?
That's right, and everyone has them. It's not a sign of hygiene.
Somebody told me in my pillow there's probably as many as 100,000 dust mites. Is it the dust mite or is it part of the dust mite?
Well, it's typically part of the dust mite that causes the most problem for patients.
And they're really microscopic?
They're tiny.
You can't see them?
You can't see them.
They don't crawl on you and you itch all over?
No, no.
But they do cause allergy problems?
Yes.
So you lay down on a pillow that's got dust mites in it. If you're allergic to those, you wake up with what symptoms in the morning?
The congestion, the sneezing, the itchy nose.
Ooh.
And if you think about it, you spend a lot of time in your bed, hopefully 6 to 8 hours or more a night.
So what can you do about that? If you're sleeping with the enemy, you're sleeping with the dust mite.
That's right. There are two things that we found to be the most effective. One of those is the allergy encasings for your mattress and pillows. And I always tell patients that those zip up completely to encase your mattress and pillow.
Do they make you sweat? Are they hot? Or do they breathe a little bit?
Typically, they're very breathable.
And it doesn't let the dust mite droplet come through.
That's right.
So you don't breathe in that if you get the covers.
That's right. And then the second step, equally as important, is washing that bedding in hot water and drying it in high heat every other week or preferably every week.
So we put covers over the pillow, we wash sheets and pillowcases in the hot cycle, and that can help prevent our exposure to dust mite because we're in bed on average, hopefully, Dr. Bob says we got to be there 7.5 hours.
Excellent advice.
So how about dogs and cats?
Yes, well, dogs and cats are more difficult, and we never tell anyone to get rid of pets, but if you can keep the pet out of your bedroom and out of your bed, that's most helpful.
Good. And cat dander versus dog dander, do you find one causes more problem than another?
Well, typically among my patients, I find that cat dander is a little more problemsome, but you know, dogs are in the home as well, and they can be a problem.
Yeah, and they are, and we love our pets, and probably the spouse is going to go before the pet goes, so keep them out of the bedroom, keep things clean in the bedroom. You mentioned mold as a perennial.
Yes, mold is both indoor and outdoor, and we keep a wet, humid climate in Tennessee, so it's very common here.
So the indoor mold, where would you find that?
You can find that in the shower. You can find that around the sinks,
Potted
in
plants.
the kitchen, potted plants.
Flood,
Absolutely.
wet carpet.
Basements,
Yeah.
damp.
So if you have that musty smell when you go in a house, the chances are it's got mold.
Yes, and you know what? Even if you don't have that smell, chances are if you live in Tennessee, there's mold in and around your home.
So when you walk outside, is there always mold in the air? Is there mold almost all the time?
Almost all the time there is mold in the air, yes.
Somebody told me the only time there's not is when there's snow on the ground, but when that melts, bingo,
Right
then you've
back.
got problems.
Yes, sir.
So all of those things cause allergies. Tree pollen, grass pollen, weed pollen, dust mite, dogs, cats, mold. And the only way you can find out if that's causing your stubby nosy congestion and fullness is what?
Having your allergy skin testing done.
So that's the only way we can tell. So if a patient is not responding to their medications, are there some side effects of those in the drugstores? Maybe a reason, or they don't know how to take the over-the-counter Flonase.
I think you've absolutely hit the nail on the head. Part of it can be the side effects. Antihistamine tablets can cause drowsiness, even the ones that are labeled non-sedating. Patients can be very sensitive to those. They don't want to have to take those every day. With the nose sprays like Flonase, the nasal steroids, the most common side effect my patients complain of are headaches, and that can occur within 10 minutes of using the nose spray.
So is it reflex or what? What causes the headaches with Flonase? With one of the cortos? And let me say, you've got Flonase and Nasacort and Rhinocort. You've got a whole bunch of over-the-counter. They're basically the same. So I didn't want to give a bad name to Flonase, but why does it cause a headache?
I do think it's from that typical reflex that you mentioned.
They have. So any other side effects of a intranasal steroid?
The more bothersome side effects can be nosebleeds, and that can happen with continued use. If you are not having your nose regularly checked by your doctor, if you're using a nose spray on a regular basis, you can thin the mucosa in the nose, bring those capillaries to the surface, and make them more easily to bleed.
So can you find that? Can you see that area on your physical exam when you're examining the nose?
Yes, a physician can find that for you.
So let's say we've had skin testing and you find somebody who's not allergic. You can treat them or tell them it's really not allergy, but there's some things we can do. If it is allergy, you mentioned allergy immunotherapy or shots. Tell me about that.
Well, allergen immunotherapy it's specific for each and every patient. That's what's so great about it. So after your board-certified allergist performs the skin testing in the office, they'll tell you what you're allergic to. You'll discuss triggers, you'll discuss medications, and if those things are not working for you, you can move on to allergy shots.
And the allergy shots, how do they work? What do they do?
They actually are a very natural approach because they build up your own immune system to fight these allergies. You become tolerant to the things you're allergic to.
And the allergy that's floating around, will it go away?
Oh, the allergy does not go away, but your tolerance develops over time.
And so essentially over time, the symptoms can go away and you may not need medications?
That's right. You could be medication free. I always tell patients, sure, you might have a day where you need an extra allergy tablet, but chances are you could be free of medications.
Can you desensitize or use allergy shots to trees, grasses, weeds, dust, mold, animals, all those things we mentioned?
All those things.
Specifically?
Specific for what you're allergic to.
So the patient that is on allergy injections boutiquely made just for them, give me some stories of the response. How effective is it?
Oh, I tell my patients 90% or more of our patients on allergy shots get complete relief of their symptoms. Certainly someone may not have complete relief, but almost everyone gets better.
So their quality of life after they've been on shots and they improve, what's it like?
Well, you have less of that runny, sneezy, itchy nose. You have less of that congestion, and think about everything that improves. It improves breathing air through your nose, but also sleeping at night. If you have better sleep, you perform better during the day, at work, at school, as a spouse, as a parent.
Can the allergy reaction cause fatigue, the Alka-Seltzer blahs?
Yes, and people often don't realize that allergies are the cause for those symptoms.
So allergy shots, allergy immunotherapy, do they hurt?
It's a tiny prick.
Okay, and so really pain, gloom, and despair is not really go along with the allergy
Even children are used to allergy shots after about a week or two.
Isn't that great? So, Erin Rohman, you're a great teacher.
Thank you.
You have to find out, what I'm hearing is you have to find out by seeing your board-certified allergist what you're allergic to, and then they can design a boutique program for you.
Yes.
Thank you so much for coming to the Dr.
Thanks for
Bob
having
Show.
me.
Well, you're absolutely great. Thank you. Isn't that great? If you've got a stuffy nose and congestion, see your allergist. Let them find out if you're allergic or not. And now you're going to want to stay tuned because we're going to be talking about shingles, devastating rash, one of the worst that you can get, and there is prevention for it. And if we have time, the difference between Crohn's disease and irritable bowel. A lot of information for you. You'll want to stay tuned. Wouldn't it be great if you never had to see your doctor because you were so healthy? Hello, I'm Dr. Robert Overholt, and I'm here to discuss the governor's initiative for a healthier Tennessee. Remember to be exercising on a regular basis and eat better foods, more fruits, more vegetables, and if you're smoking, stop. I'm Dr. Robert Overholt for a healthier Tennessee. I want to thank Dr. Erin Rohman. Wonderful discussion on why your medicines may not be working for a stuffy nose. Thanks, Erin. And now for questions from you, the viewer, that I think will be important to you. Question number one. Dr. Bob, my boss came in and said, you need to get your shingles shot. Well, let's talk about that. Let's talk about shingles. The boss had just had a case and it was obviously devastating. Well, shingles is a devastating rash that occurs as little small blisters that will occur in a dermatome. That's a nerve ending that comes out of the spinal cord to cover a certain area of the body. It's caused by a virus, herpes zoster virus, the same virus that causes chicken pox. So if you've had chicken pox, you've had herpes zoster virus, and for some reason it can go hide itself in the spinal cord. And we don't know why, but for some reason it can come out later. For instance, after the age of 60, very, very common. That's the age we want you to get immunization. Well, how common is it before that? 1 out of 3 people in the United States will end up getting shingles. It's a devastating, blistering rash. I have a friend that just got one on his face, and the blistering was where one nerve ending occurs, and it started going toward the eye. Caution. If it goes toward your eye, where your eye is swelling and it's red, see your ophthalmologist, your eye doctor rapidly, because there is treatment. If you don't see your doctor and you don't get treated, then it could actually destroy the orbit. But if it goes someplace else on your body, see the doctor, your doctor immediately, because there's medications, antivirus medications. Acyclovir would be one that you can use that will shorten the lifespan of your shingles and keep you from getting devastating after shingles pain. That's called post-herpetic neuralgia, and that's what you don't want. So can you prevent shingles? Yes, there is a vaccination, Zostavax. Talk to your doctor about shingles vaccine because everybody over 60 should have their Zostavax. One study, 2 people of 1,000, all over 60. This group of 1,000, this group of 1,000. This group didn't get their Zostavax. This group did get it. 70% less chance of getting shingles if you get the Zostavax vaccination. So get that after age 60. Take care of yourself. You don't want to get shingles, especially post-shingles pain. Now, second question, Dr. Bob, can you explain what Crohn's disease is and the difference between it and irritable bowel? Both are devastating abdominal pain. Irritable bowel, you've got cramping, abdominal pain. Some people have diarrhea, some people have constipation with it, and it dominates their life. There are new medicines for that. When you've got abdominal pain and it keeps you from doing anything, you have to see your doctor and talk to him about what is it, because it could be something like Crohn's disease. Crohn's disease is inflammation of the bowel, and it can be anywhere. Crohn's disease down the small bowel, where the large bowel starts, the complete part of the large bowel, and it causes inflammation, cramping, abdominal pain with bleeding, and it's just devastating. So you have to see your doctor. There are new medicines for Crohn's disease that we can use that can help you go into remission, or other medications that you can use. You should be guided, and you know if you've got Crohn's, you need to be guided by your gastroenterologist. It's all the time that we have for this show. Remember those 4 things we like to talk about? It's exercise. Exercise is the most important thing you can do. Reduces stress, keeps you healthy, helps you lose the weight that you want to lose. You want to get 7.5 hours of sleep. How great it is. You can get 7.5 hours sleep. Go to bed 7.5 hours before you're going to wake up. If you can't go to sleep, then you have to know how to sleep. We've given you tips before, but talk to your doctor about that. And eating properly. Eat a lot of fruits and vegetables. Make your breakfast and lunch bigger than your supper. No bedtime snacks. And if you eat good and eat right portions, you'll find also that you'll be proud of your body size. And most of all, what is it that we like in the Dr. Bob Show? You better betcha it's that laughter in your life. So I want you to giggle. I want you to laugh a lot. I want you to have fun. If you laugh a lot, your immune system will work better and you'll be healthier.